My great pleasure to introduce to you Nadine Hack, who is the CEO of Because Global Consulting. She is the first female executive in residence at IMD Business School, which, as of course, as most of you will know, has got campuses both in Lausanne and in Singapore. A Forbes Council's author, she's writing a book on the power of connectedness, and the foreword will be written by no other than the Nobel Peace Laureate Desmond Tutu. She worked with leaders globally in business, NGOs, academia, government, including Nelson Mandela. Please so welcome Nadine Hack.
Thank you. You'll note that our session is called a global wake-up call. We have two extraordinary pioneers who are going to share with us today. Dr. Andrea Pfeifer is the CEO and co-founder of AC Immune and the chair of the Global BHP Brain Trust. Carolee Lee is a Time 100 Health honored global business entrepreneur and the founder and CEO of Women's Health Access Matters, WHAM. So, Carolee, please, you've done phenomenal empirical research. Share with us the differential you've found on the funding for medical research for men and women, and why that not only affects health, but the global economy.
Thank you so much, Nadine, and thank you, Andrea, and all the organizers for including me. My background is that of a businesswoman, you got that much, and while running my business for about 25 years, what I realized was that I knew that 85% of my workers were female, but what I didn't understand is the economic impact of what happened when they weren't at work. I brought together a group of businesswomen and asked them to all chip in some money so that we could do a study with the RAND Corporation by asking a simple question. Is there an economic effect if we accelerate women's health research? No one had asked that question up until that point. This is about 4 years ago, which is a little surprising. What we would always talk about is how women were understudied, underserved, underrepresented. And we wanted data. We're a very data-driven organization. And it took RAND several years to do the study. It took us several years to release the data. We studied 4 diseases in particular, diseases that we knew would affect a woman in her lifetime: heart disease, cardiovascular, autoimmune, and cancer. And in each of those, we picked a disease category. So in brain health, we picked Alzheimer's. And what we learned was disturbing: 15, 12, 7, 4. Those are the percents that NIH allocates to studying women specifically. Women are not small men. Women are different down to the cellular level. I'm not an economist. I'm not a physician. I'm a business person. But I understand data, and I understand the power of data. Think about this. You're all here because of a healthy woman. Do you have a wife? Do you have a mother? You might have a sister. You might have a daughter. 52% of the population in the United States, about the same here, 51%. 60% of the workforce, about 56% in the US. 85% of the spending, not sure exactly what it is in Europe, but it's probably close. 80% of the healthcare decisions are made by women. We're the chief health officers for our families. Pay attention. This is a vast economic opportunity. This is not just about women. This is about the size of the economic opportunity. What we found in those 4 disease areas was the following, just to give you some top line, which is that, and you know this, Alzheimer's affects women twice as likely as a man. We don't know why. Women are 2/3 of the population who have Alzheimer's. We don't know why. If you're only allocating 12% of your research dollars and you're the largest funder of research on the planet, how does that work? If you're running a business, would you do that? I don't think so. Research is what's going to eventually change all of this, at least according to our findings and according to the data that we accumulated. And so those reports came out, and they've created a tremendous stir, because if you added up the investment of those 4 disease areas, that adds up to about $350 million. If you double that amount, you get a return of $14 billion to the economy.
So, Andrea, as a pioneering scientist, you have been working on a vaccine for Alzheimer's. But you've also uncovered a lot of critical sex-specific disease pathology differences between men and women, and how that should influence medical approaches to drug development and clinical care. Please share what you think are the most compelling points from your research.
What I'm realizing more and more, and I'm really studying this, and more sound research, like Carolee Lee, she did put numbers behind observations. Mm-hmm. And that's exactly what is happening now. There are now publications, there is research, animal research, human research coming out, which actually clearly demonstrates that women are different from men. Now, this is not a big, I would say, observation, that there are particular observations which are linked to diseases such as dementia. And it starts by, for example, having a different inflammatory potential. So certain of our protective immune cells, they age much quicker than in men. So did we know that before? No, we didn't. Obviously, there is the hormonal aspect, which we know in menopause, there is an impact on cognitive performance, brain health. That's, again, nothing new. But what is definitely new is that there is a different biology. And that part, what is the different biology, is just about coming out. So while we know in Alzheimer there is no difference in women and men when it comes to beta-amyloid and tau, so the 2 culprits of the disease, once you have the beta-amyloids, the women react in a much more advanced way. You have a much faster building up of these tau fibrils, you have a much faster cognitive decline, etc., etc. So, in fact, these 2/3 have more and more a solid scientific basis. And this is what has changed. And again, the funding going into this research is minimal still. Yes, we are starting to include women in our clinical trials, but that's one thing. But actually finding out how we use this biology in order to make a more personalized approach to treating women for these different diseases, this is what's coming out from the science now, and this is what needs to be supported.
So, Andrea, as a follow-up to that,
Yeah.
how could clinical trials be redesigned to take this issue into account, the difference between men and women?
Yeah, I think, number one, we need to understand the biology better. We need to invest in this biology. We need also to create and design these clinical trials to include women and other diversified populations. We need to potentially look into stratification for women. The clinical trials need to be powered to allow this subgroup analysis, which many of them are not. And we need to do this analysis because many of the clinical trials actually have looked at women, but the reports never came out. So there's only 12.5% of the reports on this women aspects have been published. So why is this? I mean, that would be a very simple thing. And what I hear, and even I have to take myself here, I thought, okay, so does it mean these clinical trials already so expensive would become even more expensive? So do I really want to do that? But when I started to think about it, and actually, if you do that, number one, you would find out who, in fact, responds better, and this includes other different human varieties. But what is even more important, that once you have figured out what the difference is, you can actually get to a targeted treatment of the population. And I'm speaking now about men and women. And when you think about this in terms of a payer's aspect, you actually only pay at the end and treat at the end who profits from it. So while this at the beginning might sound as more money, actually might get better results, you get more statistical power potentially, and in fact, you might get a much more support from payers because you know exactly whom you have to treat.
Excellent. So, Carolee, as the founder of WHAM, that has data-rich information, tell us why you created it and what it's accomplished and what your goals for the future are with it.
It started out as a group of women who didn't understand why no one knew the data that we had and what we could do about it. How would you change this if you tried to? And again, this got us to the data. What I want to get to is mainly to create change within our society, for women within the society and for the economy. Because if women are healthy, societies are healthy. You know all that data. If there are diverse groups of people working on problems, you have better outcomes. We know all of that data as well. A year ago, June, we hosted a celebration, for example, in Washington, D.C. to commemorate the 30th anniversary of the Revitalization Act, which mandated in the U.S. that women are part of clinical trials and research. So if I sat here and said a lot has changed, most of the people that we deal with will say politely, some things have changed, and in fact, many good things have come of it, but not a lot. And so how do we change it? And we took 20 different parts of the ecosystem, put them around the table and said, you've got 2 minutes to say, what would you change in 3 years, not 30? I'm not waiting another 30. Maybe I'll live another 30, I'd like to, but I'm gonna count on 3. And what came out of that was double the budget, that's that $350 million number. The second part of that is the investment community, which I want to talk about, and I want to talk about business, and I want to talk about women in your workforce. You know what % of the population we are. If we're healthy, you have healthier businesses. If you take a look at the workforce, and which we try to do often, we're trying to figure out how to create that kind of energy that would drive healthier women, healthier businesses. The investment community allocates, the VC community allocates 2% of their VC monies to female startups. Remember, you have a daughter, you have a sister, you might have someone, a wife, who wants to start a business. It takes twice as long for a woman to raise the same amount of money as it does for a man. I could sit here and give you data all day long. Why would it be 2%? How about this one? How about 1% for companies focused on health? Does that sit well with you? It shouldn't, right? Ethically, it shouldn't. Empirically, it shouldn't. Economically, it shouldn't. So double that budget, 350, double the 2%, which seems ridiculous, to 4%. Now let's go to the second goal. The second goal is clinical trials. And for that, we have developed our first PPP, private-public partnership, with several of our partners, Northwell Health, which is the largest employer in the city and state of New York, with many hospital systems throughout the state. Walgreens, who has a very novel way of distributing clinical trials through diverse underserved communities. KPMG, with whom we're currently doing a study, like we did with RAND, asking the same question, what now if we were to invest in companies? What if we could change this paradigm? What would the economic impact be? So that's a study that has been going on now for about 4 months, and we'll be releasing that data at JP Morgan in San Francisco in January. That's the second goal. And the third goal is create accountability indexes. Why? Why bother? Because if you're not measuring, how do you know if you're achieving your goals? What do you want to measure? Should we measure publishing? Here's a good one. How about let's make sure that the studies that the information is disaggregated in the studies. Is it when it's published? Not often, because the publishers don't have to do that. And it goes on. There are a number of indices that we're working on. So our 3 Not 30 goals, I think, are a call to action. I think everyone needs a call to action. We need measurable objectives. That's not new news to anyone who's run a business. Think about Caitlin Corico. So think about the numbers of women in society who we've left out. MIT's president, Susan Hockfield, did a study when she was president, so now probably about 8 or 9 years ago, that her female professors were not funded the same way that her male professors were funded. Why? It's a fabulous book that ensued from that, which was called The Exceptions, that was written by Kate Zernike, which traced Nancy Hopkins, who crawled around the labs at night to measure space. If you're not familiar with that, it's a fabulous book because it really does show how we're holding back a large percent of our population who have a lot to give to humanity. Her study showed that if the female professors had been funded at the same rate as the male professors, there'd be 44 more biotech companies today. Who might they be?
Thank you. And Andrea, you have...
Can I ask Carolee a question?
Yes.
I mean, obviously, I'm one of these female entrepreneurs, and I cannot say that it was easy. And I just talked to Philip, who is actually one of the VC people. Now, he told me today, and I was very happy to hear that 4 out of the 9 CEOs are female. So in 5? Oh, okay. So, I mean, this is really, really progress, because when I'm going to these investor meetings, I'm still quite often the only one. So while we have all these facts, Carolee, business is understood. We know how much women can contribute to a better, more balanced, more productive business. Why is it not changing? So we have a wake-up call. You woke up everybody. So now what's the action plan behind it? What needs to happen? Models, is it enough to have models showing that women doing a good job?
Well, you need
Do we have quota?
You definitely need success. You know, if I hear someone say, well, there aren't enough examples, there aren't enough exits by women. Well, there aren't enough exits because no one's funding them. How does that work? It's a self-fulfilling prophecy. It has to change. Honestly, I think part of it will change by everyone in this room. I'm one person. I have a great team. I have a great board, obviously. Change comes collectively. The gentleman who said it, he stole my quote. Never underestimate the power of a small group of women to create lasting and sustainable change. In fact, it's the only thing that ever has. So I'm about as open and authentic as you're going to get. And what we're doing is putting together these infrastructures that we hope can make change. So in other words, let me go back. We have the WHAM Research Collaborative. That consists of 100 researchers around the globe who feed us information, feed us data, who we can go out and poll and get information from. If there's a researcher in this room who wants to be part of that, please see me. That's 1. 2. The WHAM Investment Collaborative, which we're about to put together based on the data from the KPMG report. I'm not putting anything together until I have that data. And what's in that data? I know some of the things that are in that data that held you back. There's bias, intended and unintended. I can't change that. But I can change, perhaps, the influence of the flow of money and the opportunity. If I say to everyone in this room, and especially those people in a position of making decisions, whether at the VC level or in any business, imagine the opportunity that's in front of you. Think of it as Henri Termeer thought about rare diseases. I'm at the point now where I'm trying to classify ovarian cancer as a rare disease. It fits the criteria. He created, as I understand it, the biotech industry. How did that shift happen? Because he was able to convince lots of people that it was a great opportunity. Follow the money. Remember, I'm a business person, so now I'm back to the money. I didn't start there. But connecting now the research to the investment is because we have to have translation, and we have to be able to get different groups to be able to work together.
And Andrea, I'd also like to hear from you, because as you pursue your scientific research, you also have some very practical insights into things that everybody can do today to change their lifestyle. And that was very much covered during the last panel.
I have these sort of two backgrounds which actually come nicely together now, because as we heard today, a better brain reacts better to a vaccine. So yes, I want a resilient, very healthy brain to actually respond in a perfect way to my active immunotherapy preventing Alzheimer. So it comes actually very nicely together. I would say, while we are starting to have now medication, which is a great thing, and was so happy when lecanemab and nadunolimab approvals came out. It was for me like, okay, 20 years, but it was worth it. But this is just the starting point, and we have to build on it, and we will. I mean, my dream, and it's more than a dream, it's a dedication, it's a legacy, is to have a first vaccine against Alzheimer. There's absolutely no question.
And obviously, the work that Andrea and everyone in this room is doing is spectacular, and of course, WHAM wants to support all of your work. I think we should all perhaps consider the economic impact of what we both shared, and the fact that perhaps change could take place by driving dollars differently to places that they haven't necessarily gone to before. Think of this as the most incredible economic opportunity that's come along in a decade. And maybe...
Or longer.
Or longer. I'll take a decade, but... and consider the kinds of changes and the impact that it would make on humanity. So thank you.
Thank you so much.
And thank you.